Women's Health and Medicine in the 1800s. This lecture will discuss how health is affected by culture and society. We'll also think about who has authority over ideas of health and disease, as well as healthcare. First, let's look at medical professionalization. By the 1820s, many states are requiring doctors to have medical licenses. In 1847, the American Medical Association was created, and they opposed midwives. Thus, we see a great decline in the practice of midwifery among women. Doctors also pushed for outlawing abortion, and between 1860 and 1890, 40 states enact such laws. The medical field at this time becomes largely male. However, there are a few women doctors. The first licensed female doctor is Elizabeth Blackwell, whose picture is here. She earned an MD in 1849 from Geneva College in New York. She faced much discrimination in trying to establish her own office and receive advanced training. Along with two other female doctors, she opened the New York Infirmary for Women and Children in 1857, along with a medical college called Women's Medical College of New York. There is also a notable African-American female doctor named Rebecca Crumpler, born in 1831. She was from Delaware and graduated from New England Female Medical College in 1860. We'll learn more about these female doctors in the upcoming weeks. One reason many women were interested in medicine was to help other women. In the mid-1800s, the idea of the female invalid was becoming mainstream. Here we see a painting called The Invalid from 1870. Women were known to suffer from many ailments such as hysteria, nervousness, headaches, backaches, and anemia. Writer and health advocate Catherine Beecher stated in the 1850s that unhealthy women outnumbered healthy by 3 to 1. Hysteria was a notable female disease. It concerned unexplainable physical manifestations linked to mental symptoms. The hysterical woman was sometimes thought to be faking or wanting attention. Later in the 19th century, we have the disease neurasthenia. This relates to modern ideas of depression and chronic pain. Some connect these ailments to a lack of physical activity for women. Indeed, women and girls were often restricted in their activities. Girls were not allowed to play sports. This led many to advocate for greater exercise for women. Catherine Beecher Stowe, daughter of the famous preacher Lyman Beecher, and sister of Harriet Beecher Stowe, was one of these health advocates. She was born in 1800 and lived to 1878. She connected lack of exercise to physical and mental problems. Among the many books she wrote was a treatise on domestic economy for the use of young ladies at home and at school. And this is a short quote from her. A want of exercise induces softness in the bones, weakness in the muscles, inactivity in the digestive organs, and general debility in the nervous system. This last part, general debility in the nervous system, relates to mental problems at this time. One of the things she also wrote about, along with many others, were corsets. Corsets were very popular at this time. They were thought to hinder the development of the organs and weaken the muscles of the abdomen. Such restriction could cause poor breathing and fainting. Here's a quote from Beecher about corsets. So long as it is the fashion to admire as models of elegance the wasp-like figure which are presented at the rooms of the mantua makers and milliners, or the dressmakers, there will be hundreds of foolish women who will risk their lives and health to secure some resemblance of these deformities of the human frame. So she doesn't think this is attractive. She thinks it's deforming the body and it's unhealthy for women to want these, what she says, wasp-like figures, this hourglass figure. Because at this time, while women had to dress modestly, they still dressed to really accent a female figure like the one here. Lastly, we could talk a little bit about women's sexuality and disease. What if a woman was not passionless and pure, as we saw in the cult of domesticity? Women that showed sexual aggression were often labeled deviant, sick, and became socially ostracized. They were sometimes given the category of nymphomania, which became popular in the mid-1800s. Historian Carol Groneman shows how women were diagnosed with this disease when they went beyond the boundaries of passionless womanhood. They, along with other women, were sometimes subject to surgeries on genitals, ovaries, and uterus, which affected reproduction and general health. These surgeries were controversial and considered largely unnecessary by many people at the time,